Millions of people are having their Medicare Advantage plans canceled and not renewed at the end of the year, December 31st, going into January 1st of 2025. To be specific, 1.8 million people are having their Medicare Advantage plans not renewed for the new year. Why is this happening? Let's have a conversation about it. My name is Christian Brindle. I'm a Medicare health plan expert and specialist, and I run an agency called Christian Brindle Insurance Services, also known as Everything Senior Insurance. We're licensed in 45 states to work with you on your specific Medicare needs. Okay, we work with a litany of different insurance companies, and we speak Medicare. We eat, sleep, and breathe Medicare, as a matter of fact. And in 2025, we are seeing a record number of Medicare Advantage plans not renew their benefits for the new year. To be specific, it's estimated that around 10% of both Aetna and Humana Medicare Advantage plans are not being renewed in various parts across the country. Now, this is impacting some areas more than others, right? There are certain areas that are having very large portions of plans pull out of the area altogether. Then there's other areas where there's few, if any, plan cancellations altogether. So depending on where you might be located in the country, this may or may not impact you a lot, or maybe it will impact you very little. But Humana in particular, an article came out that stated that they have had over 500,000 of their Medicare Advantage members receive notices that their plan would not be offered anymore in 2025. Why is this happening? Well, it's happening because in some of these areas, due to the changes of the Inflation Reduction Act, it's been determined that these plans with the current benefits were just not able to be offered and provided with enough of a profit margin to make it worth it for various different insurance companies. There's also been entire insurance companies in total have their plans not renewed for 2025. An example of this is the local to Texas insurance company, Care. Care has been offering Medicare Advantage plans for several years now. It's kind of looked at as an up-and-coming plan for Texas local residents. All of their plans are off the table for 2025. So we're seeing not just plan cancellations with Aetna and Humana, we're seeing them all over, but a lot of them are taking place with Humana. Humana is also estimated to have 10% of their Medicare Advantage plan members not have their plan renewed. Over 500,000 people are not having their plans renewed for 2025. Now, if you're on a Medicare supplement plan with any of these insurance companies, or you're on a Medigap plan, this does not impact you because Medigap plans and Medicare supplement plans are guaranteed renewable. They cannot cancel your plan no matter what, as long as you continue to pay your premium. But Medicare Advantage plans are offered on a year-to-year basis on a yearly annual contract. So the insurance company always has the option to not renew that plan's contract at the end of the calendar year if they so choose to do so. One question we've been getting asked a lot due to these plan cancellations is this specifically me? Am I using my plan too much? Am I using too many claims? Am I running up too many bills? The short answer to that is no. Medicare Advantage plans are not allowed to single you out individually and specifically cancel your plan while keeping your neighbor's plan active. If they are canceling a plan, what this means is they are pulling that plan out of an area. It could be out of a state entirely. It could be out of a service area, like a collection of counties in a state. It could be just one particular county that they're choosing to pull a plan out of. But regardless, it's a specific area where they're not offering the plan anymore, which means every other person along with you in that particular area is not having their plan renewed. It's not something that's specifically singling you or anyone else out. It's anybody that's in that area that has that same plan is losing it as well. Now, what can you do about this? Well, you do have until December 31st, right? Typically, open enrollment goes from October 15th through December 7th, and that's the time frame where you can sign up for a new plan in most cases, but they actually extend it through December 31st, actually a little bit even longer than that, if you're being canceled and this is affecting you, for you to be able to pick and enroll into a new plan. So this is the time period that you will have to do that. If you do not do that, your plan will cancel and you will revert specifically just to original Medicare with nothing else. No Medicare supplement, no Part D prescription drug coverage, no dental, vision, or hearing coverage. So you will essentially have 80% coverage on medical bills and nothing more if you just do nothing and sit on your hands. So we highly recommend that if this is impacting you, again, this is impacting 1.8 million people on Medicare in the United States for 2025. We highly recommend you quickly start shopping for a plan and get one in place for January 1st. If this is affecting you, if you are the person that's being impacted that I'm speaking to right now, again, my company is able to work with you in over 45 different states. We are contracted and licensed with a slew of different insurance companies, and we can look through the different options for you and find the best one for you based on your needs and your preferences. No cost and no obligation, of course. We have a top-notch team, and we eat, sleep, and breathe Medicare, as I mentioned above. Our number is 801-255-5340. Again, 801-255-5340. Give us a call today. If you found this video helpful, enlightening, educational, please do us a favor and smash the like button for the YouTube algorithm. It's going to help so many more people like you that may be impacted by this change, that need to hear this information, find it easier, so you can help somebody today. Comment your thoughts down below. What do you think about all this? Are you outraged? We'd love to have a dialogue with you about it. Make sure to subscribe. We'll see you on the next one with more Medicare information on your specific situation. Thanks for watching all the way to the end, everybody. Happy Medicaring.